Getting a new patient in the ER can feel like total chaos. Alarms are beeping, orders are flying, and suddenly you freeze. You're overwhelmed, unsure of where to start, and afraid of missing something important. I remember that feeling all too well, standing there, frozen, not knowing what to do next. But here's what I learned: every patient, no matter how critical or stable, requires the same core steps. Once I understood this, I could stay focused, think clearly, and take action without feeling lost. In this video, we're going to break down the key steps that happen for every new patient. So the next time you feel overwhelmed, you'll know exactly where to start. With every new patient that arrives in your room, the first thing you do before even touching them is get an initial impression. This is as simple as looking at them and asking yourself, do they look sick? For example, if you're in the middle of another task, but your new patient comes in looking pale, diaphoretic, struggling to breathe, clutching their chest, or even actively seizing, you drop what you're doing and you prioritize stabilizing them first. Sometimes it's even more obvious. EMS might be bagging the patient or having them on CPAP or giving a breathing treatment on arrival. In those moments, you don't wait, you act immediately. So remember, your eyes are your first assessment tool. If they look sick, they are sick until proven otherwise. Once the patient is in your room, two key things need to happen, and they should happen simultaneously. The first is to get them on the monitor, and the second is going to be to address the ABCs. These go hand in hand and give you a real-time picture of the patient's condition. By placing them on the monitor, you instantly gather critical information. You can see their SpO2, giving you insight into their oxygenation. Their blood pressure gives a clue about their perfusion status, and their heart rate and ECG rhythm tell you if they're tachycardic, bradycardic, or in a dangerous rhythm like SVT, VTAC, or AFib RVR that need immediate attention. The ABCs provide a systemic approach to identifying and addressing life-threatening conditions early. If the patient is talking, their airway is open, but if they show signs of airway compromise, use a jaw thrust, NPA or PA, or even consider intubation for severe cases like anaphylaxis. For breathing, oxygenation is your first move, whether that's a non-rebreather, bag valve mask, high-flow nasal cannula, or non-invasive ventilation. In trauma patients, this might escalate to a needle decompression or chest tube if a pneumothorax is suspected, and in critical cases, intubation may be necessary. For circulation, assess perfusion and intervene early. This may mean IV fluids, pressors, or blood products depending on the situation. If the patient has a rhythm issue, manage it with medications, cardioversion, or defibrillation if indicated. For disability, quickly check a point of care glucose and consider a head CT if there's an altered mental status. If you ever feel overwhelmed or freeze, just focus on these two things first. Get them on the monitor and start thinking, are there any immediate ABC concerns that need to be addressed? Now, once the patient is on the monitor and the ABCs are being addressed, the next critical step is getting IV access, because without an IV, we can't give any life-saving medications. If the patient needs intubation, we can't perform rapid sequence intubation without giving sedation and paralytics, and that requires an IV. If they're in SVT, we can't push adenosine. If they're hypotensive, we can't give fluids or pressors, and if they're bleeding out, we can't replace blood products without a way to give them. While you're working on the IV, keep things simple in your head. What does this patient need? A quick action guide is, if they're hypoxic, provide oxygen. If they're hypotensive, IV fluids or vasopressors or blood products like we discussed. If it's a heart rate or rhythm issue, what meds does this patient need? Do they need cardioversion? Do they need defibrillation? If it's an airway issue, head tilt, jaw thrust, OPA, NPA. If it's a breathing issue, again, same as hypoxia, give oxygen, but in trauma cases, patient might also need needle decompression or chest tubes. Again, if it's a circulation issue, IV fluids, pressors, blood products. And if it's a disability issue or they're altered, check a point of care glucose, consider Narcan if their pupils are pinpoint. Are there any signs of trauma that may have been missed? Or does this patient need to be a stroke workup because they're not moving one side of their body? So when you get a new patient and you start to feel overwhelmed, after getting them on the monitor, after you do the ABCs, make sure that you're focusing on getting IV access. And I know that your mind is going to be running 1,000 miles an hour, but start thinking, what's the biggest issue that I need to treat right now? This mindset will keep you in control. Again, if it's an oxygen issue, give oxygen. If they're hypotensive, start thinking fluid. If it's a heart rate or rhythm issue, start going and looking into that, right? This mindset will keep you in control and will help you stay focused. And as your patient moves through the ER process, your job is to start gathering key information to piece together what's going on. This includes their current problem and their past medical history. At first, you might feel like you're taking too long or not asking the right questions. That's completely normal. Getting concise and efficient takes practice, so don't pressure yourself. Ask what you know and pay attention to how experienced nurses and the doctors ask their questions. Learn from them. For common complaints, keep your questions focused. If it's chest pain, where is it? How long has it been? What does it feel like? Shortness of breath, when did it start? What were they doing when it happened? What makes it worse? For neural concerns, assess orientation, pupils, strength, sensation, and speech. For cardiac issues, check skin color, pulses, cap refill, ECG, blood pressure. No matter the complaint, there are also going to be 2 questions that you must ask every patient. Do you have any allergies? So always ask, do you have any allergies? And what medical conditions have you been diagnosed with? Also check if there have been any changes to their medications. And again, when it comes down to assessment, it's completely normal to feel slow in the beginning. With time, you'll become faster and more efficient. So keep it simple, stay curious, and remember, you'll get better with every patient, and just keep an eye on how other nurses are doing their questioning, their assessments, and on the providers as well, because you can learn a lot from them. Now, once your patient is stabilized and you've gathered their history, the next key step is making sure the workup is actually happening. The sooner we get the results, the sooner the patient can be diagnosed by the providers and treated appropriately. Most of the time, the labs are going to be drawn when the IV is placed, but if they haven't been, it's your responsibility to make sure they get done. Don't assume they were collected, just make sure you double check. If the patient needs imaging, don't wait, call and get it moving. Whether it's an x-ray, CT, or ultrasound, these tests are often what will confirm the diagnosis. And if the patient needs an ECG, get it done as soon as possible, especially if they're having chest pain, syncope, or an abnormal heart rate. Remember, if the workup isn't done, we're just guessing. Getting the right test done quickly means faster treatment and better outcomes for the patient. And at this point, results are going to be coming back and the providers are confirming their diagnosis. Your focus now shifts to carrying out the targeted treatment and making sure interventions are actually happening. Knowing the basics of treatment for common ER conditions is key, because when things get busy, you need to know what to prioritize. This is where reviewing, learning, and experience will make a huge difference. For example, let's say your patient comes in struggling to breathe due to CHF. They've been placed on BiPAP by the RT and the providers ordered a nitroglycerin infusion and furosemide. Which one are you as the nurse going to prioritize giving first? Or let's imagine a patient who missed their dialysis, comes in with chest pain or peak T waves on their ECG. Their potassium is 7 and the providers order sodium bicarb, insulin and dextrose, albuterol, and calcium gluconate. While dialysis is being set up, which one are you as the nurse are you going to prioritize to give first? These are the kinds of quick decisions ER nurses make every shift. The more you review and learn, the easier it becomes to stay calm and take action. But again, in the beginning, when you're getting a new patient and you're feeling like you're going to freeze, prioritize the core things, which are going to be getting the patient on the monitor, addressing the ABCs, placing an IV, and asking concise questions. The ER can feel overwhelming, especially when you're new. I know how tough it is, trying to keep up, worrying about making mistakes, and feeling like you're always behind. That's exactly why I created these resources to help you gain confidence and take control faster. Our book is your go-to guide for essential ER knowledge, designed to give you exactly what you need without the fluff or overwhelm. It covers the most important ER concepts, including triage, ABCs, advanced life support, and critical emergency conditions, all explained in a clear, easy to digest format. Our course includes the book and takes your knowledge even further with step-by-step video lessons, efficient charting strategies to protect your license, and practice tests to reinforce your learning. It also includes real-world scenarios to sharpen your critical thinking and decision-making skills so you're prepared for high-pressure situations. If you're ready to feel more confident in the ER, grab the book or enroll in the course today. You can also access the course by joining the channel. Just click join. Links are in the pinned comment section or in the description below. And as always, teamwork makes the dream work. And here at Emergency Chaos, we are proactive, not reactive.